Welcome. I know it's been a pretty busy day, and this is, by the way, in the program. This is down as a 2-hour workshop, and I'm sure if you're going by the program, you're going to be super relieved to know that it's actually only 90 minutes. Only 90 minutes. But on your app, I think it's corrected as a 90-minute workshop. This is called Advocating for a Better Future for Your Loved One. Everyone can be an advocate, and I just want to give a big shout out before we begin to our friend Dina Andriola back there, who's with Takeda, who sponsored this workshop. Thank you very much, Dina, because, you know, she's one of our many friends, and we have many friends who really believe in advocacy, and I'm hoping that those of you who are advocates or are going to join or have already joined our advocacy team at the LGS Foundation. And if you haven't, darn it, by the end of this, I hope you will have considered it. If not, absolutely we'll be doing it. So I'm Jennifer Griffin, as I said, Director of Family Support at the LGS Foundation. So in today's workshop, okay, if you're thinking advocacy, we're going to think really broad with advocacy. So we're going to begin with healthcare advocacy. And then we're going to follow up with a little IEP or IPP or person-centered planning or wherever you're at advocacy, because some still have children who have IEPs and some have, you know, loved ones who are adults. And it's usually called something different, but there's usually some sort of a program for the future when they're adults. And then lastly, we're going to really talk, pull it all together and tell our own family story. So my own advocacy story, I won't tell you too much, but, you know, back in the day when my son was 5 and I was, you know, completely, I hope those of you who've been there or who are there know what it feels like when your children are only 4 and 5 years old. You're like a deer in the headlights. And somehow I landed really, I don't even know how it happened, in a program called Partners in Policymaking through the ARC of California, where I live. And it was an advocacy training program. And there's going to be a little element of that training that I'm going to add into this workshop. But I was also, there's an organization called Family Voices, and they have national chapters, and the California chapter, I eventually went on to become, they have something called Project Leadership, which was an advocacy training program for caregivers. And so I was a trainer. And so I would give those workshops for families in our community. And just one thing about the Partners in Policymaking that I think is really important to know, that it is actually 50-50 caregiver advocates and self-advocates. So there are a lot of individuals with disabilities who are also part of that, because, you know, they, even if they have intellectual disabilities or they struggle maybe with communication, we all know that our loved ones are very, very good at letting their needs and wants be known, and we have to respect that and honor that, and that is their version of self-advocacy. My own son, who is 22, nonverbal, but there are times when he is super clear what he wants, and I have to recognize that and honor it. Okay, so there's a little 4-step process to advocating. You know, first of all is just, you know, introducing yourself in any situation, right? And a little bit about yourself and your loved one. You know, I am Jennifer, I'm the mother of Theo, he's 22 and he has LGS. LGS is, you know, you might want to tell them a little bit about what LGS is. It could be anything that you want it to be. And then the next one, it always starts with a problem, right? So we're advocating because we've got something that we need addressed or fixed. And then we go on to, you know, what happens if this thing isn't fixed, the impact. And then we finish up with making some sort of an ask. And this slide will come up again later on when we start to share our stories. This is going to be somewhat interactive, I hope, this workshop. And none of you are shy. And if you're shy, You're going to learn not to be shy because you're going to be an advocate. Anyhow, so today we're going to do, the first thing we're going to begin with is healthcare advocacy. And Jeannie, this is maybe where we're going to have a discussion here in this group. And maybe you can just chart some of the things that come up in that discussion. Okay. So the first thing we want to talk about is, what is healthcare advocacy? So does anybody want to hazard a guess at what healthcare advocacy is? Wow, advocating for your loved one's health care. Holy heck, I think that's a good enough idea. Right, sure. Let's just call it that, right? In the healthcare system. Yeah, sure, in the healthcare system. We might even go back to, I haven't asked this before, but I did another advocacy workshop on Thursday night. Anybody not know what advocacy is? Which is really how I should have started this, I guess, but hindsight being 2020, I know that. It's really, and I'm just going to tell you, it's really speaking for others, on behalf of someone else. That's called individual advocacy. Self-advocacy is speaking on behalf of yourself. So, like that person in that picture is probably telling their doctor, well, it hurts right here, and I need you to fix that. That's, that's healthcare advocacy, self-advocacy. And then there's systems advocacy, and that's advocating at the bigger system, which is what people find really daunting when they hear the word advocacy. They think that it always involves politics, and we have to remember, as I said at the very beginning, everyone can be an advocate. So, where does it take place? Where does healthcare advocacy take place? These are not really hard questions, but anywhere, everywhere? Yep, it can. And when you're specifically advocating on behalf of yourself, where is that woman in that picture? Right, and where is the person in the bottom picture? In a hospital, right? So, kind of medical settings or with medical professionals. Hey, you run into somebody who says, I am a chiropractor, and you're at a dinner party. You might want to say, yeah, I got this little thing right here, we sometimes do it in our personal lives, and I'm sure the doctors are really appreciative of that. How much time do you usually have? How much time does everybody here have in their typical doctor's visits? 5 minutes? Oh, heck. Okay, yeah, write some of that down. Let's say, okay, 5 minutes. Hey, we got 5 minutes. Anybody got 10? Anybody got 10, 15, 50? I feel like I'm going to be 30 minutes. You get a 30-minute visit. That's great. Actually, okay, for 5 minutes, how old is he? 22, right? Okay, 22. And do you see an adult provider? Okay. Okay, so he's with you for 5, and then he's getting ready for his next patient. We probably want to start passing around a microphone too, so that because I think this is being recorded. Now, Cassie, your daughter is only 5 years old, right? Then you get 30 minutes. 30 minutes to an hour in the pediatric environment, and yeah, and that's And yeah, you should probably, so what we'll begin this new habit of speaking into a microphone when we talk. And do you want to know something? You know where I learned that? Partners in Policy Making. They made us, we did 9 months of workshops, once a month for a whole weekend. They would take us somewhere, and by the end of it, people would be shouting at you, use the microphone, so we had to get used to it, because a lot of the time when we advocate, we speak into microphones if we're advocating like at a systems level. Okay, yeah, my son, we used to get an hour or however long. We used to get the last appointment of the day. And so it could go on as long as we wanted it to, because I think it's because the doctor, she and I were just, I don't know why, we just started to become kind of friends with each other. But now my son has an adult doctor, and it's 10 to 15 minutes. And okay, so what do you discuss in these appointments? And there's a wide variety, so put your hand up and we'll run a mic to you and you can tell us what you discuss. Yes, over here. Oh, over there, over here, over there. Over everywhere, yes?
What's working, what's not working, new research. Just the door is wide open with ours.
That's good.
So,
how old is your
he's
loved
6.
one?
He's
6.
Mhm.
Okay.
So same thing, 30 minutes to an hour is
Yeah.
kind of
Interesting,
how long it keeps
right?
attention. Yeah.
And yeah, you get to dig deeper into what's research and stuff. That's great. Did you? You had your hand up down there over there. Oh, both of you.
Oh, thank you. Our visit is usually an hour, and we discuss our concerns from the last visit that haven't been fulfilled, or what's our next step. My son's 33, and we're looking at different things, and of course, we're on this journey. You get used to what's happening, and as they get older, you kind of get in a routine, and then all of a sudden, a new behavior pops up.
Yeah.
And so then we have to discuss the new behavior and how we combat that, basically. But the real concern is how to discuss it without, since they're recording everything, it's how to discuss it without making it appear that the child, having something bad put into their record, like
Right.
Behavior.
Yeah.
I could say my son is aggressive. Well, I'm not going to tell the doctor that because I don't want it in his file. I will tell them that he pinches me or something like that. So it takes a long time to discuss all that with them.
So you're trying to express it to your doctor, but shape it in a way that you feel respects your son.
Yes.
And doesn't sort of label him as, difficult, but
Right.
it labels him as having certain
We have a behavior issue
certain
that we'd
elements
like
of
to
his
address.
LGS that are very typical of the.
Right.
That's good. That's good. Okay, yeah, it's nice because I was concerned for a second because I thought, I think we need to mention those things to the doctor, but you want to shape it in a way that
Right.
respects your son.
Right. Well, and because I don't want it in there. I don't want, if something were to happen to me, I don't want them to think, okay, we've got to put him in a padded room because he's aggressive.
Oh, okay.
No, that's not the case. It's,
Sure. Okay.
so you have to really walk through it
Good
with
to
them.
know. So, okay, so that's great. That's another example of things that you discuss. Did you have anything to add, Heather?
Sure. So we transitioned 4 years ago from pediatrics to adult, and I'm not a fan. We got lucky in the sense that we have a really good, friendly doctor, but he was new and young, and he had not been familiar at all with LGS. So I felt our first year was teaching him. And then from there, we've developed a relationship of learning together. So our appointments usually 60 to 90 minutes, and they usually involve, okay, based on what we've added to your daughter's care,
Wow.
what have you seen? What do you like? What do you not like? As well as, all right, well, what new stuff have you researched in the last 4 months? And he will go to seminars, or he will collaborate with other specialists we've met in other states, because I've got doctors in 3 different states for her, and I make them all talk to come up with the best care. So it's usually me reminding him nicely, don't forget to reach out to so-and-so, and
That's wonderful. You know what I love about that? It's that it sounds like you have a real partnership with your doctor, and that is, I think, that's the dream, right? We don't want to be, as Tracy says, we don't want people just throwing things at us. We want it to be with us. And so for some of the other ones, how do you prepare for these appointments? Like, what is it you would do if you had an appointment coming up? Oh, did you have something to say? Oh, sure, please.
So we're very newly diagnosed, and our appointments are usually between 90 to 120 minutes long.
Nice.
Because we usually it takes us about an hour to discuss. We're in that testing phase, so we will discuss what was last done or what orders he just had done. And then, what results we are getting, where we're moving forward, and probably another hour to discuss, like, what's next, what are we going to do, how's he doing, the plan, any modifications that we're going to do. We have kind of a love and hate relationship with our doctor, but we don't dislike her. But I do challenge a lot of the things she says, and I advocate a lot for my son to things I want to get done. And
Well, this is good, because we're gonna get into that a little bit more about, how we can do that, right? So, and when you have those 90-minute, 120-minute appointments, how are you preparing for those? Are you keeping records? Are you researching, bringing information? What kind of things are you doing?
yes, I researched everything. I'm also in the medical field, so I discuss it with the doctors and anesthesiologists that I work with,
Good.
and even patients that I have. And so I go home and I do a lot of research on my own, and I come prepared with notes and the research and the data that I've looked, and see if things are applied to my son, and or if these are things my son is a candidate for, or we can test for as well. That's another reason why I came to this convention for the first time, to see what knowledge I can bring back and what applies to my son.
Oh, you're way ahead of me. Okay, I'll pick up on that one in a second. And where do you get your information from? Well, where did you get your information from? Here, I should ask other people too. Just in case everybody can chime in on this.
I mean,
You just said it. This conference, right?
this conference, and well, when we're 3 months diagnosed with LGS. This is very new to us. I hadn't even heard the term before, and the neurologist at the time in the ER said, he named LGS as, these are the type of seizures your son is having. So I went home and looked it up, and I discovered it's a syndrome. It's not just a seizure type. And so all my information I got for the LGS website, and I went back there, and we actually had a 4-hour appointment with her that time. I said, I need to further look into this. Like, you can't just send me home with nothing.
That's one busy doctor. Okay, anybody else have other places where they get their information from? What's that? Exactly, the LGS Foundation, the website?
Here at the conference, sorry.
Conference.
The LGS website, the community on Facebook. When we were diagnosed, this was such a big step for our family to understanding and moving forward with where we were at. And then, we did attend virtually. We were lucky to be diagnosed just before the last conference, and here I am again. For the first time.
I was going to say, if I was giving prizes in this workshop, I would have just given you a prize for the answer that I was looking for. I was looking for a lot of answers, but the one that I really wanted to hear was other families as well, right? Because we get it, we go online, we go down that Google rabbit hole, Dr. Google rabbit hole, and then there's also, the LGS Foundation, and then ultimately, there's also other caregivers. So that's great. Okay, so now we're going to stop, and we're going to do our first activity. And you all have these purple binders, and if you wanted we can, you got one. Okay, I was going to bring one over to you. Just the very first page is all we're looking at right now. I should have one. Jeannie, can you hand me one of those so that I can bring it up? So the first activity is going to be we're going to plan our next doctor's visit as if it was going to be this week. We're only just going to take 5-10 minutes to do this. And you're just going to consider those things that I said, okay? We don't have to introduce ourselves, those 4 things that I talked about at the beginning, because we all, the doctor hopefully knows who we are, but if it's a first-time visit, you might want to, I might go into an appointment with a new doctor and say to him, I don't know if I would tell a doctor I work for the LGS Foundation, actually, because that might make them mad. But I would hopefully come off as a parent who has done her homework and knows things and wants to really collaborate, right? So then consider what I said. There's a problem, and then there's an impact, and then there's an ask, right? So what is something, I want you guys to go in there, and based on your experience in the last 2-3 days here at the LGS conference, I want you to think of one thing that you can take away from all the talks and all the people you've met and all the other kids and adults with LGS that you've seen. And what has sort of made you say, I need to know more about this? I need to talk to my doctor about this, because One thing I don't like to do, and I try to train people away from this when I'm giving these kinds of talks, is that advocacy should not be, and I'm not a big fan of the word should, okay, but this is what I like. It should not be adversarial. This is not your enemy that you're talking to. This isn't the other side. This isn't the person who just doesn't get it and is so stupid and they never told me about that and everything, because I'll bet your brains are about to explode with all the information you've been given. And there may be a thing or two that you just never heard from your doctor. And we've talked a lot about how we don't always hear about clinical trials and SUDEP from our doctors. And instead of walking into the doctor's appointment and saying, how dare you never tell me that my child could actually pass away from this? You know, you want to say, I heard something interesting, and I think we need to talk about this. I need to hear where you're at on this, you know. So find a way to sort of reframe that feeling of frustration or anger that you had when you heard that piece of information that you wish you had got from your doctor. So that's the reason for your doctor, and then you maybe just one question that you're going to ask, and then maybe what are some of the next steps you as a team, you and the doctor or a healthcare provider, or nurse practitioner, whoever it is, can come up with, and then maybe discuss what you want to talk about at the next visit. Like sometimes, you know, if they have a VNS and you're considering turning up the VNS, but right now you might want to say to your doctor, I think we want to hang out for another few months and let's revisit that at our next appointment. And then if there's any kind of troubleshooting that needs to be done, we can talk about troubleshooting in a few minutes. So I'll give you a couple of minutes to work on these. And then I hope the few volunteers might share. What time did we start this, since it was delayed? Was it 2:45? I don't even know what time we're going to now. Was 2:45? Okay. Okay, that's good then. I should have had some music playing while you're doing this. I'm so sorry. Oh, here. It's supposed to be a 90-minute workshop, so if we started at 2:45, then it's supposed to be going to 4:15, okay? Or whatever. It's on a loop. It could just go on and on and on. Are people still writing? I didn't give you much time to do that. Okay, I'll just hang out. Okay, do I have a volunteer who wants to maybe share a little bit about? Sure. Now you're gonna stand up and you might just talk to the rest of the room like we're your doctor and just say, okay, so here's what's going. Just talk to us like maybe you would to your doctor if you can stand up too.
Taking me out of my comfort zone.
I'm taking you totally out of your comfort zone.
I think one of the things that we need to discuss would be his medication. I think that he's on a lot of medications, and we need to maybe see about reducing some, because I have been holding on to, he's on 2 medications that you have to, I guess, level out. Take one off while you can add one, and he's been at a good location with the 2, but if I can take off the one and keep going up on the other one. So he's on Xcopri and Vinpat, and those 2 together, I guess you're supposed to reduce the Vinpat and increase the Xcopri. But he's been at a good place, so I've not wanted to ruffle that feather. But he's on 6 medications, so if I can take one off, then that would help. But then going and also reviewing the VNS. He's on a VNS, and he's been on that for maybe 6 years. We've already done a battery change, and I don't really see it working. So is he a candidate for the RNS? He's 18, he has a lot of things that I think would go towards. The only thing would be he's generalized, I think, versus the focal. So I guess it's a conversation that her and I would have to, I don't know. Even if if our hospital does that, I don't know. So
that's great. So so you started with the problem. You think he's on too many meds, right? Oh, I should actually ask other people to sort of weigh in. Were there other problems? No, I'm asking everybody in the room that just listened to you speak. What did they hear you saying? As far as problem, we can skip the introduction part and it's just say, is there a problem? What is the impact? And what is the ask, right? The problem is
He's on a lot of medications.
Too many meds. Hard to manage is the impact. And then the ask was sold. Did you know what the ask was? Yeah?
I would probably say,
You got the mic.
for me, I would probably say bring the meds down to 4%.
Okay. That's a
So-
good ask. That is a good
so-
ask.
Because I, in real life, have take only 4 pills per night per day.
Okay. Okay, thank you. Okay. So that was really good. That was really good, and thanks for being brave and being the first person. Because you obviously had things to offer up as well. You didn't just say, fix this. You said, I'm really concerned, and I really want to, I think we need to maybe reduce the number of meds. And I know we're playing around with these 2 meds, but while we're doing that, I just came back from this conference, and I heard a lot about this RNS thing, and I got to tell you, VNS hasn't really been, I haven't been a big believer in it, right, for quite a long time, and now I see an alternative. So that's great. Can we get one other person to share? Oh, so I'll get back to you in a sec. So, yeah, did you want to try? Okay, so Emily, you're going to try?
Okay. First and foremost, I would bring to our doctor's attention that we are still waiting for insurance to give us a denial or approval for us to go out of state for our surgical workup to restart. That is one of my main concerns. And then something I learned at the conference and also the past few months, my cousin passed away from SUDEP. So definitely would say, hey, my cousin passed away. What is the concern for my child? This has never been brought to my attention. I would also want to know something about winning a med as well. She's on 4 medications. We experience nothing but side effects. And I would like some input on where we could start.
Fantastic. That's so good. That's great advocacy, right? Because you talked about the dreaded word insurance. That's a long haul that you're probably in for. But it's good to include your doctor in that. By the way, actually, when I'm thinking about that right now, it's more than a good thing. It's almost imperative. We do everything on our own. We fight, and this is where I can use the word fight, right? Fighting with insurance, Ben, we were talking about that earlier, right? About all the, the different things that we have to do. If we want to take this medication, but we need to do this one and this one and this one and fail them before we do this one. Or they'll require a prior authorization. All of a sudden, it's January. My child has been on this medication for 6 years, and what happens? They've decided that we need a prior authorization in January because insurance has decided to change some of their rules beginning January 1st. I'm always very, very aware in January about when I go to that first pickup for some medication. I think, anything different? Or there's the medication may have lost its indication, and now we're going, there's a generic option, and they want you to go to the generic. All these things that frighten the heck out of us, right? So thank you. And then, but then you also raised a concern about SUDEP. So you were saying we need to have a conversation. And then when you were talking about weaning the meds, you didn't just say, I just want to wean these meds. You said lots of side effects. So you were saying the impact there, right? And then your ask was for some input from your healthcare provider. So that is really good, really good. I'm glad. I'm going to move along. because I want to get to this next part. So now, before I do that, yes, when I talk about troubleshooting, when you run into challenges, right? When you are in those situations where it doesn't go smoothly and somebody's not listening to you, or you feel like there's actual, like maybe you're in a hospital environment and so you're not working with people who really know your child and you think that they're doing something incorrectly or inappropriately. In a hospital setting, there are ways to go about it, and some are like asking for somebody, you know, it's one of those can I speak to your manager kind of moments, you know, where you, and it's usually like a charge nurse or a social worker or someone like that. And then there's this whole process, right? If it's not resolved, then you can file a grievance. And usually I think it's like they have about 30 or 60 days to investigate and give you a response to that grievance. And they have to give you their response in writing. And by the way, if there's 2 words that you need to say to yourself again and again and again and again throughout this journey, it's in writing. You make a request to your school, you make a request to your doctor, you make it, because if it's not in writing, it didn't happen. And then if you're still not satisfied, there is this, I can, you know, I mean, this links out to Beneficiaries and Family-Centered Care Quality Improvement Organization, which is an arm of the government where you can actually, they can direct you to who the local entity is that can take on your grievance. So this is, instead of, you know, having to hire a lawyer and things like that all the time, there's a process before you have to do that. Some people like to go, they think that they have to go straight to legal, and then they spend a lot of money. So we're trying to avoid that, and that's all these people do, is deal with grievances. And then, of course, insurance denials, you know, learn your insurance plan's appeal process, because a denial is just, you know, something they do sometimes, you know, but there's often a way to, an appeal process. So very often when you appeal something, you'll get the desired response. The problem is, who has the time for that? And also a lot of families, like newer families, younger families, people in remote areas, people who aren't very well educated, people who don't speak English as their first language, you know, people who are intimidated by the system are going to take no for an answer. And they don't have to, because you appeal, and very often they just were looking for you to work a little harder to get them to say yes. And I don't want to demonize insurance companies, but maybe I do a little. And then prior authorizations like that I was talking about that happened at the beginning of the year, and generic formulations. So yes, microphone.
Times you have to talk with them. Mm-hmm. And I have to do that a lot with mine, because I just get denials and you want to know why it was denied. So always, always, always keep notes of who you talk to, the time you talk to them, and the date, and what the outcome of that conversation was. Supposedly they will be putting it into their computer system, but make sure you have it. Right. You think you won't forget, but you do.
Yeah. Yeah, I mean, has anybody ever dealt with any business in the world where you talk to one person, they give you one answer, and you talk to another person, they give you a completely different answer, and then you talk to another person, they say, I don't know. You know, it's just, it's the beauty of, I always say, how many of us have the time to call a number and then just get a menu of options? For 1, press this. For 2, press this. You know, or for yes, press 1. For no, whatever. Yeah. So we just don't have that time, and then it takes us to another menu of options, and then you know, it's just, and by then you just want to. You're probably day drinking or crying or something, right? Okay. So now we're going to take everything we've just learned and we're putting it into a different place. And the reason I'm doing the workshop this way is because at the end, when we talk about telling our story, I'm going to give you something, a specific something to tell your story about. And you're going to see that all of this kind of advocacy, it's the same. So, Jeannie, I think this will be a little charting here, and we'll move along a little faster in this one. everybody know what an IEP is, right? An individualized education plan, right? Or a person-centered, what is a person-centered plan? Anybody? Okay, so for those of us who have, does anybody, what? Oh, who knew? Oh, go, no, you go, Cassie, come on.
The person-centered plan is just about the person.
Right, and do you know, there's actual, like when they become adults, definitely, there's usually an entity, I don't know if every state has them, I know in California we have a regional center system. And what they do every year is they have an annual meeting and you have a case manager, and they're called a service coordinator, but call it what you want in different states, a social worker or whatever. And they meet with you and they develop what they call it the IPP, which is the individualized program plan for the person who has the disability, who is their client. And it's very much like an IEP. And really it comes down to one thing. What does it come down to, Melissa? Wait, give Melissa a microphone. She knows what it comes down to.
A meaningful day for our people.
That's right. What is their day going to look like, right? That's all an IEP is. And that's all, and an IEP, though, it's all about accessing the curriculum. Believe it or not, if you have a fourth grader who is severely intellectually disabled, they are still hopefully going to have real fourth grade curriculum adapted for them. And it could be adapted pretty significantly, as we know, but that's what they're trying to aim at. So where do these things all take place, right? I mean, you can just throw out answers. I mean, it's just school, and then the IPP or the person-centered plan or whatever it's being called, home, or in a residential facility, if they live in a residential facility. And then how long is everybody's IEP meeting? This is okay, doctor's appointments, that were 90 minutes and 60 minutes and 10 minutes and 5 minutes. How long does your IEP last? A couple of hours, 30 minutes? 30 minutes. 30 minutes to an hour. That's an efficient school. That's pretty good. Yeah, as
It's not starting from scratch.
yeah, as they get older, it gets a little quicker just because you're pretty clear on what you want to talk about.
Right.
Sure.
Just
that could
any
be the case.
changes are the things that need
Yeah.
to be noted. Otherwise, you just sign a bunch of papers.
And also, a lot of the time, it depends on the culture of the school. Because you know how an IEP, of course, is a legal document that supposedly you can take anywhere in the country, right? But as we all know, it can work differently from one state to the next, indeed from one school district to the next, right? So they all have their kind of way of doing things. But just know that if you ever hear the word policy, well, it's our policy to not provide physical therapy. That's against the law, right? There's not, policies are different than laws. IDEA is a law. Okay. And of course, what do we discuss, right, in an IEP meeting? Here, microphone. Okay. Yes. Oh, yeah.
I'll just echo what she said. PT, OT, speech, the therapies the school's providing, their goals, whether they're educational goals or just social goals, emotional goals, the objectives, progress towards those. Miss anything?
And okay, since you have the microphone, and you probably all have been through IEPs, I'm just going to ask you, so what is the first thing you talk about?
So I'm also an educator.
Right, good.
So I get both sides. I get to see both sides of it. Really, the first thing that when we're sitting down with my son personally, is they discuss right offhand, they start with the positive, the progress. I mean, and I don't know if that's everyone's protocol policy, but kind of in our school, this is what we've seen that's the positive initially. And then, and I think that's having some more conversation with parents, because actually our lead SPED teacher is a special ed parent as well. So she's really hard on the parent side of things. And then it goes into the specific goals that have been established, and each therapist, pretty much everyone is present, whether it's by phone or not. So each of his therapists are there, his teacher is there, I'm there, our district liaison is there as well. So there's a lot of people, a lot of hands on deck that all had their say.
Right. Great. Yeah. The first thing that is by law, the first thing to discuss is what they call present levels, right?
Yeah.
And I love that your school starts with strengths, right? Some call it strengths and areas of concern.
Mm-hmm.
Some, and I once had a teacher, my favorite teacher ever for my son, and she was great because she said, they want to hear about strengths, but the only thing they're ever listening to are the deficits, right? It's so deficit-based, which is really quite interesting because we think, well, of course, right? All the problems, right? Remember when I was saying the 4 steps, you've got a problem? Well, yes, we've got a problem, right? But if we also have a strength, we want to know what those strengths are too, because we can use the strengths to help fix the problems. So we need to hear the strengths as well as the areas of concern. So I'm glad you mentioned that. And you just said what happens at a typical meeting. I mean, here's what happens. You start with your present levels, which are the strengths, areas of concern. And in there, of course, you are talking about, the problem or whatever, or the, you set goals. And the goals aren't necessarily based on deficits and problems. They're also based on, okay, where are we at with the previous goal? And where do we want to be? Or do we need to keep working on this goal? Or do we need to adjust the goal a little bit because he or she may be struggling with it and maybe we've just set our sights a little too high, so we need to reframe, make it a bit more of a realistic and achievable goal, right? And then after that, we go into, once we've set the goals, then we also do the services and supports, so you've got your instructional assistant, you've got your OT and PT and speech. How long are they going to be coming to see your child? Are they going to be coming twice a week for 45 minutes? Are they going to be coming once a month, just on consult to check in? All of those things. These are all the things that you are talking about and negotiating and all of that. And how do you guys prepare for your IEPs? Ben? Yeah. Oh, there you go. Back to the day drinking. Thank you. I'll bring to that, but it's just lemonade.
I don't know how much but when you talk about IEPs, I think, especially for those people who are new, we had been through a lot of them. It's really important to record them. I think it feels aggressive, but there was at least one time when we did. And it was amazing because then we had the recording of the head person on the other side saying, well, we know none of those 3 schools are right for Addie. And it was like we woke up in the middle of the night, wait, they said. And as soon as we sent that clip to our attorney, she's like, thank you for doing my job for me, case closed the next day. So to do that, and another reality that's hard, especially, I don't know if it's all cities, but a big city like LA, is you can get some things you want. Like you can say, we want OT twice a week, whatever, and they can say, yeah, we can give that to you. We don't have the OTs available. So I've heard a lot about that.
Oh,
so I think what I want to say is not...
If you get that on tape, that's a real good thing to do
yeah,
on tape.
so, but it's
we
also...
don't have any OTs, sorry.
Right, so it's great you got it. We can't.
Yeah.
So it's good to know what's possible,
Yeah.
is I guess what I'm saying.
Yeah.
As well as what you need.
It's interesting because recording a meeting can be considered adversarial, right? And you have to give them 24 hours notice, and they're allowed to, and then they'll record it as well. But at the same time, you can also, it's all about how you go at it, right? I mean, if you go at it and just say, I need to I forget a lot, and I just need to do this because I need to make sure that, because I'm going to review it and remind myself of the things that we discussed, then that's fine. But if you say, I don't trust you, therefore I'm going to record you, of course you're going to put everybody on edge, right?
And it's emotional, right?
It's
so
emotional.
You're there, and what our IEPs were a lot about is always emphasizing the negative. So in reality, that was the upsetting thing. Going in is like, remember, we're talking about everything that's really hard for her.
Yeah, that's good, because when we prepare for it, aside from day drinking, I mean, there's also the emotional preparation that you're doing, right? You know it. Yes.
Jen, just add on to that. Is like in the last 6 months, it's becoming really common for people to use AI assistant note-taking apps for video conferences. And in addition to having the recording of the conference, you get a transcript, you get tasks and commitments pulled out in some of the cases, so that it can be really, really effective, and it's becoming more common. So asking to have a note-taking app along with a meeting is actually considered kind of best practice now.
And I wonder how, I wonder how school districts, compliance people, what they feel about that. I don't know. I mean, hopefully they'll see it as a good thing. Yeah, there could be, but that's all about the discussion, right? Did you have one more thing, and then we'll move along?
I think what I had struggled with most of his years is a one-on-one. Yeah. And then once he became, with the epodialect, they wanted to add a nurse. So he had a one-on-one and a nurse for junior high. And then when he went to high school, they wanted to remove the nurse and provide him with a person that was able to do one-on-one and nursing together. Yeah. But then also you need a behavioral plan and all these things. So those are, when you have your IEPs, you need to make sure that those things are in there. Plus also, once he had been officially diagnosed with autism, then they wanted to remove speech so that he can now have social skills. I was like, no. So if you go into their school program and look deep into what they want your child to have, then you can really see, oh, okay, they want a better life for your child. Okay, bring that up. Your district is saying they want this for your child, and now you're wanting to remove it from your child. Yeah. So if you investigate into their district policies and all of that, then you can pull out and tell them, this is what you guys are saying you're going to do, and now you're saying you're not going to do. No.
Right. Well, I'm going to help you look at that a little differently. Because when that happens, right, okay, in my previous job, every September, school would start at the end of August. And then we would just sit there and we'd brace ourselves for the flood of phone calls from all the parents, because, a lot of the services aren't in place. They said in his IEP, we agreed that he was going to have a 1-to-1 aide, and the school has an aide shortage. And they've had an aide shortage in our school district ever since my son started school. And he just turned 22. So it never ended. But here's the thing. I would get these calls from these parents saying, my child needs to have a 1-to-1 aide. And I'd say, why? Well, because I just started school and so has a 1-to-1 aide, and if they have a 1-to-1 aide, I'm for sure my son should have a 1-to-1 aide. And I say, okay, well, then you go into the school district and you might want to actually have an informal or a formal IEP meeting. You can call an IEP meeting whenever you want. And then you sit down and you say, okay, listen, I want a 1-to-1 aide. And the school might say, no, I'm sorry, we don't think your child needs it. And that's where the fights begin, right? So how do we take all of the anger out of that? One of the things that I think we do is we start with the question, why? So if I'm the school personnel, I'm going to say, why do you want a 1-to-1 aide? And if you say it's because so-and-so's kid has one, then you're not doing a very good job advocating for your child. You need to say because he elopes, because he has self-injurious behaviors, he has pica and he puts things in his mouth. He needs to be redirected all the time. Something like that, right? You need to make a very good case as to why you want what you want. He has seizures all the time and falls to the ground, and things like that is why you might want an aide or a nurse or etc. Right? And if they continue to say no, then your job is to say, okay, you're to ask them why. Okay, I just explained to you all these concerns I have. So can you, and this is the part that I've always found very useful for parents, can you help me to understand why you're continuing to tell me that my child doesn't require this service when I've just explained all of this to you? People love to help. And I always like to remind families that, educators did not get into that business for the money, right? But they are part of a system. and the system is flawed, and sometimes the system sucks big time, right? And sometimes there are, you know, difficult educators, and sometimes they're difficult caregivers, you know? And so we have to make sure that everybody is in a partnership, just like with your doctor. This is another partnership. The most important person in that meeting is the person, the I. And it's always going to revolve around that person, your child. I don't care if you like the doctor, the teacher, and I don't care if the teacher likes you. As long as the two of you are, have always got that person at the center of all your discussions, then it can get heated, it can get angry, it can get whatever, but as long as you are listening to them and they are listening to you, and, you know, it's a super emotional experience, as we've already established, but it's a really good, I'm gonna move on, but yeah, we can talk more about this one. Okay, so this is our activity, okay? It's going to be the second page in your little folder, and we're only going to spend a few minutes on this one. But just, you know, if you were to sort of develop, and we didn't really talk about the person-centered plan, but it's the same idea. So talk about, just write down in here some of the strengths that your loved one has at home or at school, depending on, you know, how old they are, and a little bit about, you know, things that they might need some help with. And write up one goal that you'd like to see, and maybe how you think that goal needs to be achieved, okay? And then maybe what sort of support they might need for that goal. In other words, how do you think their day is going to look? Marginally better with this one goal, just one. I don't want to hear about all, well, I mean, you can do whatever you want, but when we report back, let's just sort of focus on one. And yeah, I'll give you a couple more Jeopardies for that. Or maybe, how about this?
I think snails deserve a song. I do. I think snails deserve a song. I do. Don't you? Oh, they take their time.
Tell her some jokes.
Can't move. Fast on the ground, they hide under leaves. Slide through my yard, escape into trees. Coaxing them out of their beautiful shell. They come out for me 'cause I love them so well. I think snails deserve a song. I do. What is this slime over my walls? I think snails deserve a song. Is that what I think?
Ben, we're recording this. Do we have your permission to have used this on the recording? Ben wrote that. You'll learn more.
It's all your fault, Tyler Price.
Okay, so I've just been told that they're cutting all these workshops short. So I'm not going to actually have you all report back, but we can all talk amongst ourselves later on, and you can keep writing. We're not ending it yet, but I just wanted to move on to the last step of this, the third thing. And here's some troubleshooting notes for IEPs. I always like to try to tell people to never go alone to an IEP. Bring a friend. Bring an advocate. If it's an advocate, please have it be, you know, a friendly advocate, like not somebody who wants to keep fighting and says, let's go for money, let's go for money. Yeah, sometimes you can, you know, get money out of the district, I guess, sure. But, you know, I mean, a couple of years ago, my son there was a real problem in his classroom, and I had to pull him out of the classroom, and it was really, the teacher was going through something, and all of the aides were quitting. And my son's a big guy, and he needed support, and his aide, our favorite person in the world, quit. And I thought, oh, God, you know, and I had a total open and shut compliance case with the district if I had wanted to. And, you know, maybe, I don't know, maybe they would have given us money or something. All I wanted was for him to have a day, a full day. And so I said to the district, okay, this is a really out there kind of request, but his aide just quit and he needs a job, and I'm not putting him back in school. Do you think you would hire him to be a one-to-one from 9 to 3 every day? And they were like, they sure preferred that solution over, you know, a compliance complaint, you know, at the district level. So they said yes. And for 6 months, he had this guy that would come to his house and he would plan a day for him. He would take him to his OT and PT appointments, and it was really great. And it was total out-of-the-box thinking. So, and I'm sure the district had never done that before, or seldom. But I didn't ever hear from them, oh, we don't do that. Because they knew this was a much more reasonable solution for everybody involved. You know, ask for help, like I said earlier, and keeping your loved one at the center of every discussion. But, you know, if you're troubleshooting, you might have to go to mediation. You might, or due process is the ultimate but you might have to do that. 75% of due process cases end up in favor of the district, not in favor of the caregivers and the families. And that's not because 75% of the cases are bad. It's because 75% of the cases, those are the cases that made it all the way up to a due process hearing. If a district is, you know, if it's pretty clear that the district is out of compliance and that they're, you know, kind of the guilty party or whatever you want to call it, they will almost always settle before, more often than not, like they did with us, right? They just said to us, sure, yeah, we'll give you somebody. Because if not, then I would have had to go to, you know, due process. Didn't want to do that. And you can always file a complaint with your state education agency when you know, think that there's been a violation of IDEA. There's also sometimes before due process, there's like a mediation part. That's usually where the things are settled. Okay, and a few tips for all types of advocacy, right? It's you know, I mean, it's like I'm your mom telling you to be friendly and polite. Don't shout, don't make it personal and all that kind of stuff. But also, it's just it's hard sometimes. Emotions come up, right? Let's face it, I've had emotional moments and testy moments, but I try to keep my cool and try to be professional, but it's hard because we're talking about the person we love the most in the world that we would do anything for. You know, I'd jump off a bridge for Theo, right? So, and be prepared, right? Because when people ramble, you lose your point. So try to be specific. And, you know, be mindful of the time. That goes more for the doctor's appointment. The IEPs, if it doesn't all get resolved, they can just keep rescheduling, you know, continuation IEPs until you reach an agreement. And yes, be accurate. Don't make stuff up. Okay, people make stuff up sometimes, but and that's just because this really goes for a different type of advocacy. If you're sitting down with a senator or a politician and they say, tell us a little bit about LGS, and you start saying, you know, 95% of people with LGS, you know, don't make it to their 3rd birthday or something like that. Well, that's just not true, right? But people sometimes want to, they're not remembering some of the things they've heard, so they just start making stuff up. So, and if you're meeting with like a politician, like your senator or your congressman or whatever, it's a perfect opportunity to say, you know what, I'm not sure, but let me get back to you. Okay, so speaking of politics, oh no, not yet. What does the IEP and the doctor visit have in common? Right. Your family, you guys, right? So, remember this, the 4-step process. Okay. Introducing yourself, introducing a problem. What is the impact? You know, what will happen if? And here's how our families' lives will be affected if this problem is not resolved. And here's how you can help, right? We want you, and you make an ask. So, the reason I did this whole workshop this way is because we wanted to talk a little bit about different types of advocacy, definitely healthcare advocacy, because we want our families to really go into their appointments, you know, armed and ready to just really have it work to the best, in the best possible way. But ultimately, I look to the future for Theo, my son, and I see a big, dark place, because I don't think that the world is really set up yet for adults with disabilities and this type of disability. Because, you know, I hear from families a lot of the time, well, I'd like to put my child in this group home, but they don't have a nurse on staff and they keep messing up the medication. I actually had somebody tell me once that they kept adding water to her daughter's medication just to make it last longer. And guess who ended up in the ER, right? And then there's the other group home type, which is really focused on, you know, the medical stuff, but they're not addressing the behaviors because, oh, well, we're nurses and doctors, we're not behavior specialists, and we don't know what to do when so-and-so is punching and kicking and having some aggressive outbursts and stuff. So that's a problem, right? And then we have in almost, I would say, I think there's only 8 or 9 states in the union that don't have paid caregivers. Now, I'm from California, and we can pay ourselves as caregivers, so the state can pay us as caregivers. But in most, I'm going to pretend, if you live in California, pretend this doesn't exist. And I've created this mock bill, and this is something that I did when I was in Partners in Policy Making, and we came up with this mock bill. And then we went, they took us to the state capitol and they put us in a hearing room and we all had to write a testimony. And when you are talking to a politician or you're going to a Senate hearing or whatever, and there's always a section of time put aside for public comment or a school board meeting even. It could just be, you know, going to attend a school board meeting, public comment. You look at the agenda, you see what's on the agenda, and you say, oh, item number 3, I'd like to make a comment about that. And they have a section where people can make comments on all the agenda items. And then they often have a section for just general discussion, so just something that you may want to bring to their attention as a future agenda item. So, let's say this was on the agenda, and you went to your state capitol, and they'll have a section, a group of people, it's now time for public hearing or for public comment, and people will line up and a lot of them will have maybe a little prepared statement that they'd like to make. These are timed statements, and it could be 1 minute or 2 minutes. In the interest of time, we're going to do 1 minute. So here it is. It's called I made up this bill. I call it SB 1357. It's a Senate bill. It's at the state level. And it's called the Paid Caregivers of People with Disabilities Act. And this is, you know, it's called the Individuals with Disabilities Home Care Program, and it provides in-home assistance to eligible, aged, blind, and disabled individuals, and it allows recipients to remain safely in their own homes. And paid caregivers can be family members of the IDHC is the Individuals with Disabilities Home Care Program. So, and to be eligible, this is the stuff. Like, this will be the thing that you'll be learning about this particular bill, right? So now, today we're going to have this this Senate hearing. So I'm going to give you guys a few minutes to just write out for 1 minute how you think. Introduce yourself. Introduce the issue. And introduce the impact of that issue on your family, and then you're going to make an ask. And the ask will probably be, well, depending on how you feel about this, it could be, I don't agree with this particular bill, and please, you know, do not sign it. And it could be, you know, therefore, please, I would like you to please approve or pass SB 1357. That's it as your ask, right? You know, just please, you know, consider my family and pass bill number SB 1357. So I'll give you a few minutes. Just write out a little something, and maybe we'll have a few people stand up and give their testimony. Hello, my name is Jennifer Griffin, and I live in Santa Barbara, California, and that kind of thing. My son Theo has Lennox-Gastaut syndrome. And you might want to say Lennox-Gastaut syndrome is, or because of his Lennox-Gastaut syndrome, he does this. And that's, a bit of the problem and the impact. Anyhow, so if you don't understand, I'll walk around and I can answer any questions if you're kind of stuck. But if you think I got this, Jen, then have at it. I did mention, didn't I, that it's actually here on a form in your folder. I hope everybody found the form. Forgot to mention that part. Going to be going through my head at 2 in the morning. I guess it stopped. I won't annoy you any further. Has anybody finished theirs that would like to share? What do you? Kurt? Come on, Kurt. You're on our advocacy team. Did he? Kurt, do you want to? I don't like to volunteer, but I am kind of doing that right now.
Are you volunteering me?
I'm volunteering you.
I'm volunteering you.
Sorry.
Hello, my name is Kurt, and I am the dad of Addison. And Addison lives with Lennox-Gastaut syndrome, which is a severe and rare form of epilepsy. And Addison suffers from seizures daily and requires around-the-clock care. And because of that, our family is really financially burdened because there has to be someone with Addison at all times. And really, in order for one of our family members to work, there needs to be a nurse or an LNA with Addison at all times. And the challenge is, we can't find someone suitable to come in. It's a very big challenge for someone to come in and be with Addison. And it would be significantly easier for a family member, a parent, to come in and be Addison's paid caregiver. So for that reason, I support this bill. I encourage you to support it as well.
All right, give me a hand. Oh my God, Kurt, that was fantastic.
Policy.
That was, okay, did we get he introduced himself, right? And a little bit about LGS, which was perfect. The problem, you got the problem, right? Round-the-clock care. I should have left this up too. The impact, financial burden on the family, no one suitable available, all that stuff. And then, of course, you did the ask. So, way to go, Kurt. That was fantastic. Yay. All right. Don't be intimidated by Kurt now, everybody. Yep, please, please. And you know what I'm going to do this time? Don't be afraid. I am going to set a timer, which I didn't, but you actually kept it under a minute, because believe it or not, these people keep timers, and they'll even, you know, it'll be up there, and you'll be watching, and then they'll just say, okay, thank you, you know? Okay, thank you. At the end of your time. I won't do that. I won't do that, but you might hear my timer go off, so hit it.
Okay. Hi, my name is Christy Garrett. I am the mother to Walker, who is 6 years old. He was diagnosed with Lennox-Gastaut syndrome at 4. I have a fact sheet that I can provide for you to learn more about LGS if you would like. But we live in Dublin, Georgia, which is a small rural area in the middle of the state. So we are 1 to 2 hours away from the nearest pediatric hospital, and actually all of his specialists are in Atlanta. So living in the small area, we have limited resources and access to services and therapies that he needs. And so I have to I actually had to go to working part-time so that I could have time to take him to all of his appointments and to see all of his specialists. So that has placed a financial burden on our family. And also just kind of the social impact of, you know, giving up a part of a career that I love, but to do it for my son. So having this bill pass would really to benefit our family and my son particularly, because it was just a choice that I had to make, was willing to make, but it would help make that sacrifice just a little bit easier for our family.
Thank you. That was exactly a minute. And the only thing I would add is, yeah, I mean, I think it's pretty self-evident, but you might want to say, so please consider families like mine and support SB 1357. And that would have been like another 2 seconds. And by the way, when they hit a minute, they don't shut you up in mid-sentence. They just say, thank you very much, and then you just finish what you're saying, you know. And sometimes they even interject, which is kind of horrible, like 30 seconds, 10 seconds, you know, just to remind you to get to the meat of it if you haven't yet, that kind of thing. Okay, it's 4 o'clock. I'm not sure what time we were supposed to stop, but does anybody else want to get up and give it a whirl? And you know, then they'll just have to come and haul us out of here, or if you're needing to, if you get the point and you want to be done, that's fine too. But I think that just so you know, okay, that was time to share your stories. That's what you just did, and then I just said, okay, you're all advocates now. But before, I just want to plug the LGS Foundation has the Advocates for LGS, and we started this a couple of years ago, and we are trying to find different ways of sort of engaging our community to participate in systems advocacy, especially because we see the need, and we also see how it's overwhelming for our families to sometimes get out there and do this kind of thing. But it's also, it's critical because, you know, we can complain about the system, we can cry about the system, we can always feel like LGS has just landed on us, it's happened to us, it happens at us, it's, you know, never happens with us or for us. And so it'd be really nice if we all consider the fact that sharing your story the way you did just now is the same thing you did at the IEP meeting. It's the same thing you did with your doctor, and it's the same thing you do in your personal life when you're talking to your loved one about, you know, your spouse, and you're saying, you know, you're not agreeing on something and you're trying to, you know, state your position. Or if you're going to your boss and you're asking for a raise, or you're, you know, you have to advocate for something. We do it all the time in our lives. And when we advocate, that's all we're doing is we're using our personal experiences to affect change. And, but this is always, you know, a little bit more for us because it's our children, and you know, our children are more important to us than we are to ourselves. And let's face it, all of us feel that way. But something like this bill, you know, getting it to be a paid caregiver, you saw how everybody's story, the 2 stories we heard, impacted the entire family. It impacted your quality of life. For socially, I love that you threw that in, because it's not just about, you know, earning a living and all of that stuff. You want to have you don't want to give up who you are and what matters to you for your child. We shouldn't have to do that. We should just be able to find ways to enhance our lives, but also keep our loved ones cared for, cared about, and safe. So thank you all very much. And I'm around if you're interested in learning more about the Advocates for LGS, because nobody has to have any experience. It's just, you already have had plenty of experience in your lives with LGS. Thank you.